What actions account for the success in reducing the hospital readmissions, in your opinion?
Well, one of the things very early on is when patients are being screened to be discharged to a facility, there are on-site liaisons that come into the hospital from the facility. So, for example, from Baptist, we have an on-site liaison. So these 20 facilities plus have liaisons, and they did not have access to our electronic health record. So we're transitioning from a paper record to a computerized record.
Electronic, computerized.
And so that was the very first thing we did, which allowed the liaisons to look at all the accurate information and transmit that information to the nursing homes.
Sure, and that's a major change, certainly.
Yep. Yeah. The next hurdle was getting a clinician at the nursing home to have remote access, so that when the patient was transferred, if there was any information they were looking for, whether it be a procedure result, a lab test, just what they found in the emergency department prior to admission, the clinical folks at the facility can look at that patient's record.
Right.
The other thing we did was develop a nurse-to-nurse report prior to the transfer, and the most important thing was the nurse at the hospital reviewing the medication list with the nurse at the nursing home.
Right.
And the nurse has the information, both nurses have the information, so they are able to clarify and ask questions. Sure. Because as we know, the medication process is complicated.
It can be very complicated, that's right. Sure.
That is one thing that we continue to work on.
Right. But to be able to do that in a very timely manner and much faster, obviously, than had been done previously, I'm sure has made a big difference.
The other thing that was very significant is our visiting nurse colleagues at Albany Medical Center are on the group, and when a patient is transferred to a subacute facility, they go in and visit the patient and work with the social worker at the facility to look at when the patient's leaving, they then are set up with home care.
Sure.
So it's hospital to facility to home with home care. And so that helped to have a safer transition.
Yes.
And, you know, it helped to reduce readmissions.
Sure.
I also visit at the facilities in my role, so I go in once a quarter and I look at how the care's going. I ask the patient how the transition went and what can we do to make it better.
Sure.
And I get feedback from both ends, how it went when they left the hospital and how it went when they were admitted. That transition for people is very it's a big change, and it can be very stressful.
It can be very traumatic and stressful, yes, it can be, absolutely.
Right.
Wow, that's great to know that you go out and you talk to the I'm sure the staff at the facility as well as a patient, and that's got to be very helpful. So,
yeah, it's very, very satisfying
and
for both.
very rewarding too to see the progress and then to find out areas that maybe you need to do a little bit more work on. Right. Wow. Once again, if you just happen to have logged on, this is a live web chat, and my name is Tim Bartos. I'm speaking with Karen Houston, who is the Director of Continuum of Care at Albany Medical Center, and we're talking a little bit about discharges from the hospitals, and whether it's to a nursing home or a rehab center, to home, wherever it may be, hospice, any number of discharges, and we're talking a little bit about that. So if you'd like to weigh in or ask Karen a question, now is the time to do so. You can email us at chat@cbs6albany.com, or you can send your questions through the CBS6 Facebook page. I want to ask you, Karen. We've been talking about the coalition that Karen helped bring together in the last couple of years. What has been the group's biggest challenges, and maybe you could even go beyond that? What do you foresee as even bigger challenges in the future for the group?
The biggest challenge the group has had is timely, accurate patient information. transitioning from a paper record to an electronic record is a challenge, because some of the information is in the paper chart, some is in the electronic record. So what we did is we brought together folks from our medical records department, and we came up with what is the most critical information that you need when the patient arrives. And the patient comes with a packet of information. Some of it they need ahead of time, some of it they need, right when the patient arrives. So that's been a challenge, because, care evolves and information changes. And the biggest challenge is reconciling the medications, what they had in the hospital, when was their last dose, does the facility know all the meds so that they can have them ready and
exactly, so they're ready. They don't miss it. You don't want them to miss
a dose.
Right.
And that communication back and forth is definitely better, but it's still a challenge.
That's still a challenge, but it's improving every day.
It's improving, and I think our next opportunity is, and we're working with our information technology folks, is transmitting information electronically to the facility. So having a portal that we push information to, and the nursing homes can grab information in a timely manner.
Right, which will help speed things up and hopefully more accurate, and peace of mind for everybody involved.
Clearly, the clinician, in the evening hours, having access to the patient's record has promoted good patient safety and transition.
Absolutely, absolutely, very important. I'm wondering if you could just share a little bit about a few successful outcomes of the group.
Well, we clearly our reduction in readmission rate is our biggest outcome, and we continue to strive to drive that down. The other outcome of the group is and we don't expect to get readmissions to zero, but any readmission that we have, I review that with the medical team at the facility to look at what did we miss. Is it a new acute illness that came up? Was it preventable?
How could we have prevented it?
Did the hospital prepare the patient appropriately and give you all the information? Did you have the care? Did the patient go to the care setting that was most appropriate? Another outcome is we developed for our ED clinicians a capability grid for each nursing home. So by that I mean each nursing home listed what they're capable of doing, whether it's lab tests, x-rays, certain medications, consults available, because the ED physicians were not really up to speed on, patients coming into the ED and then knowing, does the facility have the capability to take them back? So that's updated as we get new facilities in the coalition, and then that grid is online in the emergency department at Albany Med so that the clinicians can see. We developed a communication tool as well, so when the patient comes to the facility clearly delineates what they're looking to have done. The patient may need a procedure, the patient has some clinical symptoms that need to be evaluated, and that communication has helped.
Wow. Now, I know we talked earlier about the award that the group received for reducing readmission rate by a little over 30%, right? A little over 30%. And I know you'd like to see that higher. And as you said, it's probably unrealistic to think that we could ever get it to zero, but certainly the goal is to get it to as high a number as possible.
And it's amazing. Each facility tracks every month their readmission, and then it's collated by our colleagues at iPro. And it's so exciting when an individual facility has a zero readmission rate for a month. They're thrilled.
Yes, absolutely.
They're thrilled.
I was going to say, and to have a total of over 30%, that really is an outstanding number. For folks who really don't understand, that is an outstanding number, so you really should be very proud of that.
Yeah, we are very proud
right,
and excited. It's a team effort.
And exactly, and to get that far, I mean, it's only going to get better. It's only going to get better. So I guess my last question for you are, what are some of the next steps for the group?
Well, one of the exciting next steps is we are developing a brochure, and this will be handed out to patients, which really describes a lot of the work of the coalition, what we've talked about here this afternoon, and it also lists all the organizations and the location. Patients want to go certainly back to Albany Med takes patients from 25 counties, so our goal is to get the patient as close to home as we can, based on bed availability. And so this brochure we're very excited about handing out to patients and families. And then,
when do you expect the brochure
actually,
to be ready?
we're in the final draft, so I would think July.
Okay.
July it'll be out, and
it'll be around the corner.
Just around the corner. It'll be distributed at the hospital, and it'll be available in all the facilities as well.
I was just going to say each facility will have it as well.
Each facility will have it as well, and I think the next step too is educating other disciplines in the hospital about the coalition. Nursing is clearly aware. I think our other colleagues in physical therapy, occupational therapy, pharmacy, and that's part of my work at Albany Med is getting the word out that we have a collaborative, and we work very closely, and are very proud of the transitions.
Absolutely. Wow. Well, thank you.
Excuse me.
Oh, go right ahead. That happens.
Oh, dear.
Karen, I want to thank you so much again for taking time to come down here. This has been very enlightening, and you're doing some really outstanding, wonderful work at Albany Medical Center. And for folks who would like some more information, you don't have to write this down. We'll put it on the CBS 6 website. But if you'd like to get in touch with Karen directly, we'll have a number.
I'm happy to take emails. Or
Just going to say, I'm sure you'd be happy to take emails, whatever. If you want to speak with Karen directly, or any member of her staff, that would be happy to answer whatever questions you might have. And so we'd love to hear from you. Karen would love to hear from you.
Yes, I would.
So we'll put that on the website.
Okay,
so
great.
People will know.
Thank you for having me. It was an honor, as I said.
Well, thank you so much again for coming down, and thank you everyone who logged on. And I hope you have a great month, and we'll see you in July. Bye bye.
Bye bye.